I apologize for that. So I guess we'll just start over again. This is Dr. Kent Jackson. I'm the president of the board of Platte County Health Board of Trustees, and I want to thank everyone that's given too much. So first of all, we'd like to have a roll call of who's here as part of the board. Kathy Wright?
Here.
Kathy Gill?
Here.
Paula? Here, Paula. How about Dr. Hills?
I'm here.
Okay, Dr. Hills is here. All right, so are there any additions to our agenda?
No.
No additions. So we're going to move into the public comment part. We've allotted an hour. So we'd like to try to get everybody to be able to talk in that amount of time. We've allowed about 3 minutes for each speaker in order to get through that. If it becomes your turn to talk, then if you raise your hand so I can know you are there, and we can go ahead and hear your comments. This meeting is being recorded, and it will be posted on the website. And everybody hears what I've said so far. If you can raise your hand. Thank you. All right. So if we try to mainly just listen to the comments and make notes.
I don't know.
If it's a simple question that I can answer, I will try to answer it for you. But if it's something more complicated, then we'll definitely have to get back to it. So we have a list of people who wanted to be on the comments part, and we're just going to go down the list in order. The order was established by email by the request. First person on the list is Scott Freiker. Is Scott Freiker in the audience?
He's not.
Anybody know? Okay. How about John Bushman? John, I see you. Hi there.
I'm here.
Can you hear me?
This is John Bushman.
1 second, John. Hold on 1 second. Hey, can you speak? Let's see if we can hear you.
All right, this is John Bushman.
Hold on a second. Try again, John.
Okay, do you got me now? This is John.
I got you there. Here's what I'll turn mine down. Okay, speak again, John.
This is John.
All right. Okay, I can hear you now, I think. You can go ahead.
Good to go?
Yes. Okay.
Hi, my name is John Bushman. I live at 9401 Northwest 78th Street in Weatherby Lake. I think that there's some fear out there about this virus, and I think that fear has led many to forget about critical thinking. I want to add something to this conversation that I think has been accepted as a given, and I want to question it. That something is contact tracing. I would like to understand. I have not heard it explained to me at any level, whether that be national, state, or local. What is the objective of contact tracing? Specifically, I would like to know what is the Platte County Health Director's objective regarding contact tracing and the COVID-19 virus. If the objective is containment, well then I would say if it applied to Ebola, then I'm all on board. Ebola is a very lethal virus and we would need to contain it. I'm in. We have to find everyone that has been in contact and isolate them immediately. But when we see the COVID-19 virus, it is different. This virus is widespread and is no longer possible to contain. Data has demonstrated that there are many who have already had the virus, but showed no symptoms or only had mild symptoms. They all carried COVID-19 virus and never knew it. When we see a Platte County Health Director order that initially required and then was modified to encourage businesses to collect names and phone numbers of everyone who comes into their facility, in the case there would need to be a need for contact tracing, I get deeply concerned. Frankly, I don't like the idea of giving up my name and phone number because I don't understand the point of doing so. What is the public health director going to do with that information? So I walk into a Platte County business and then it is determined that someone who is positive with COVID-19 also walked into that same place, let's say a grocery store, something we all frequent, and I just happen to be there at roughly the same time. What happens to me? What happens to my family? What is the county health board going to do with that information, my name and phone number? Are they going to order me to isolate me and my family? To what end? Do we all have to stop our lives and livelihoods on the slight chance that we might have been in the vicinity of someone who tested positive? I would like the Platte County Health Board or director to explain to me their objective of contact tracing. What are they trying to accomplish through contact tracing? Nobody has said it. I have not heard it once, not at the national, state, or local level. No one has questioned contact tracing. It just seems to be a given that, oh yeah, we have to have the capacity to do contact tracing in order to move forward. Let's put fear aside for a minute and do some critical thinking. What is the realistic objective of contact tracing in Platte County? If we have no defined objective, then why are we doing it?
Yeah.
Thank you.
Okay, thank you, John. Sorry about the echo. Is it echoing to you guys too? Make a comment about this?
Hey, Dr. Jackson, Dr.
Yes.
Jackson, this is Dr. Hills. Could you just remind everyone, I'm getting a lot of background noise, that to please mute their, to mute themselves if they are not speaking, because I'm getting a lot of birds chirping and all kinds of stuff. So I would appreciate that so that I can pay close attention. Thank you.
Okay. Thank you. All right. Hey, John, thank you for your comments. And we'll figure out an answer for you. Okay? All right. The next on is Wes Minder. Wes Minder there?
Here.
Here, okay.
Here.
You may go ahead, Wes.
Just thank you all. Name is Wes Minder, 7422 North Amaret, KCMO 64151. Like the board, but when I first started researching or trying to figure out agendas and whatnot, I had a hard time finding the information on the website, and also there was no list.
Sorry, you're breaking up a bit, Wes.
I think a lot of angst and I think a lot of the angst and anxiety that you're seeing tonight is just because the 2-week comment period process is not very amenable to citizen input, or it creates that anxiety because you don't have to post your agenda till 24 hours before a meeting. But if I want to make a comment at that meeting, I have to post it 2 weeks in advance. So I think that's a policy decision that I don't think is being handled very wisely. I also don't think the information available on the website is being handled very wisely. So I would just encourage you to post these agendas in advance on the website so that if someone misses a meeting, they can go to it, read, learn what's going on, and then have the information from it. Because a lot of stuff that you're seeing and a lot of the information that the angst, that I'm not saying that it wouldn't happen, but I think there'd be a lot less of us that would be concerned about the way things are being handled if we had better access to the information and all this information was more publicly available easily so citizens could learn about what is going on. And with that, I'll thank you for your time.
Okay, thank you for your comments. All right. Next is Scott Onsez.
Thank you, Dr. Jackson. My name is Scott Monses. I live at 5303 Northwest 78th Place, Kansas City, Missouri. I'm also a member of the Park Hill School Board, although tonight I'm speaking purely as a citizen. I just want to, 2 weeks ago when I made this reservation, a lot of things have changed since then, but I've heard good reports of communication between the health department and at least the Park Hill School District, so I'm pleased by that. I see that Tammy Saylor is listening as well, and she's our main contact, or she's the main contact for the school. Thank you, Tammy. I am concerned as a citizen about how long our kids have been out of school. In the Park Hill School District, it's been since March 16th, I believe, was the last time they were in person in school. The Park Hill School District has done a great job filling the gap and figuring out distance learning with about 10 days notice. So they did an awesome job. But I would like us to have in-person summer school, and it's scheduled to start July 1st. And I know that the school district obviously wants to be safe, and I want that as well, that we don't want to take any unnecessary risk, but at the same time, it appears that this disease doesn't have as much of an effect on folks under 55. So I would encourage you to continue to work with our school district and get comfortable with the school district's plans, and to allow them to have school July 1st. Thank you, sir.
Thank you very much, Scott. Okay, next is Nancy Cross-Womack.
Hello.
Hello.
Yeah, I'm Nancy Womack. I lived in this county for 42 years. My husband and I have built and sold hundreds of houses in this area, and I've had Northridge Farm for 32 years, and Dr. Jackson has been my veterinarian, and I consider him a friend. But I'm here to talk about why people in this county are so angry, and I'm going to give you feedback on that. My business is considered essential, but what has been so stressful for me is to see what is happening and how people are reacting to this. Because in the beginning, we all agreed this was a frightening virus. No one knew that much about it. So we did our part. Everybody cooperated, stayed home, sanitized, stayed apart from people. And it was all about mitigation, flattening the curve, and keeping the hospitals freed up. But this is what I'm talking about now tonight. What happened to mitigation? Mitigation means to make less severe and less serious. It doesn't mean eradication. And I am concerned that from what I read about the reopening plan and what the board has discussed, that they are hoping for some sort of eradication, which I don't think is going to happen, and also waiting on a vaccine before we can ever go back to normal or not have some sort of social distancing. And on the task force call on May 5th, Mrs. Vernon said the goal was to blow case counts off the charts. Well, we only have 110 cases as of today, unfortunately 1 death, but these are extremely low numbers. And it seems that these sort of numbers and statistics do not warrant this overreaching and stringent reopening plan. So people in this county are angry. I visit with a lot of young families that have school-age children. They are very distressed about the plans they hear about divided school days and not going to school. I've had many people express to me that they would rather send their children, keep their children for homeschooling rather than send them. The sports restrictions are just outrageous. I mean, you cannot have sports if you can't touch the same ball, and this is over controlling a population that is very rarely affected by this virus. So, and putting churches in a category of a non-essential business and prohibiting people getting together based on the square footage and percentage number is not right. It should be maybe social distancing. But, and the other thing that I find that makes people very angry, you end up putting the businesses as the responsibility if someone should die or contract the virus by saying that if we go back too soon, people will die. Well, you know what? Maybe someone will die and someone has died from this. But that has never been the goal, is to have complete obliteration. It was mitigation from the beginning across this country. And I don't understand, and I'd like to know why you have changed your protocols. So I'm just sharing this. I want you to understand why people are so agitated and so angry. So that's what I have to say.
All right, thank you, Nancy. It's greatly appreciated.
You're welcome.
All right. Amy Felton. Is Amy here? All right. Todd Payne, see you there.
Yes, I am. Good evening. Can you hear me, Dr. Jackson?
I can, thank you.
Fantastic. Dear Platte County Board of Health, I appreciate the opportunity to voice my concerns. My name is Todd Fain. I live at 9638 North Bradford Avenue, Kansas City, Missouri 64154. I am a member of the Park Hill School Board, like Scott Monses, and my wife and I are parents of 4 children. I just wanted to support really each of the points that Ms. Womack made. I am asking you to seriously consider the impacts of your reopening plan. I want to make sure that we can mitigate the economic damage over a shortened period, but also balance the goals of making sure that we protect those at highest risk going forward too. This is not a virus that's going to magically go away, and we don't have a vaccine. And I believe that it's critical that we use evidence and data to drive our decisions going forward. So again, appreciate the opportunity. I want to limit my comments because much of what I wanted to touch on has already been mentioned. Thank you.
Okay, thank you, Todd. Marcia Vanderveer? Marcia here? All right. Janet Stark? Is Janet here?
Yes, I'm here, Mr. Jackson. I noticed that Mr. Spricker he got on just a couple minutes late, and would it be all right if he spoke and then I'll go ahead and speak?
We can do that.
I want to give him that opportunity.
Okay, go ahead, Scott.
He's muted, I'm not sure.
Can you unmute on your screen, Scott? Scott?
It's life. All right, there we go.
Are you there, Scott? Okay.
It's never good.
Scott,
Yeah, I mean, I originally wasn't going to speak because this postponement of the meeting was very frustrating. Is it? I hear a lot of background noise. Is this my opportunity to speak?
ask everybody else.
Yeah, go take your bath or whatever.
Well,
I'm not gonna listen to you in 20 minutes. Sit there and fucking say that you want to take a bath, and you're hungry, and everything else.
hold on a second.
Everyone else needs to mute for you to
You don't
talk.
need your towel until you get down your bath.
Muted.
And this is a great example of why this online meeting is ridiculous. Why couldn't we have met in the county commission office like we did 2 weeks ago? All right, this is ridiculous. I mean, we could have met last night, and the decision of this board to not go forward with an in-person meeting is unacceptable. All right, I have a lot of comments to make, and all I hear is crickets and background noise. All right, and I have no idea why we can't meet in person. Can you please explain that with me? I have some comments I'd like to get to, but I'm not okay with this.
Okay.
Why couldn't we meet in person?
Well, last night we felt we could not do it because of keeping within our proper number of people and also the social distancing.
No, I don't believe you. That's not
There's
true.
one other thing. I actually would not, as it turned out, I was not able to go anyway because I had to go on emergency. So we couldn't have the meeting anyhow. So, not the point. But
All right,
I do apologize for you.
Were you afraid of having a group of 20 people in a room together, all in opposition of what you've decided to do here?
No,
I mean-
20 people, we were well prepared for 20 people. We were afraid there was going to be much more than that. That's why
Yeah, but
we
you had already determined a schedule where only 10 people at a time were going to be in the room. What was wrong with that? Why couldn't we go forward with that? We weren't going to charge the room and force more than 10 people at a time into the room.
Okay, I don't know that, but yes, I agree.
I mean, you gave us the guidelines and we all accepted it. So why are we here in front of a computer screen
Scott,
Yeah.
I'm sorry to interrupt you. This is Dr. Hills. With all due respect, let's keep this to a level of, let's not raise our voices. Let's just try to make this. I
Hey,
understand.
Teresa, I appreciate where you're coming from, but I'm okay raising my voice because I'm pissed off.
Okay, can we go on your, I
I
apologize that you have this feelings, but could you please move on to your comments? Let's move on to the business at hand.
All right, I'm gonna go ahead and give you my comments. All right. First of all, you've stated that your order is essentially the same as the state's order. Mary Jo, are you on the phone call now?
Yes.
Yes.
Okay, you made a point in the newspaper the other day that your order is essentially the same as the state, right? And that if you didn't have your order, we would revert back to the state's order and it would be essentially the same, right?
Correct.
That's what you said. So I suggest that you revoke your order and let us go back to the state's order. If they're essentially the same, why are you going through all this hassle to convert a 2-page order to a 12-page order and make constant amendments to the order and deal with all these issues when what you really should be doing is taking care of the growing public health needs like hunger, domestic abuse, alcoholism, suicide prevention, all the other problems caused by this shutdown. Listen, we're proud of the work that the health department does in this county, all right, but you are ignoring it so that you can control the local economy, okay? Revoke the order, okay? Now, I don't expect you to do that. So short of that, what I would like is that we get some decent information. For example, what metrics are you using to move to the next step? All right, is it total new cases? Is it positive test percentages? Okay, it can't be hospitalization rates because we all know that hasn't been an issue in this county at all. It's highly unlikely to be an issue in the future, all right? So for positive cases, so let's just say you're looking at positive cases or positive test percentages, all right? Are you looking for the numbers in Platte County? Are you looking at the 9-county metro area? Or are you looking at the state? Okay, we need to know that. And why isn't that data published on the website every day? All right, the information that you have there is worthless if it doesn't help us figure out where we are compared to where we need to be. All right, people need to have hope, which means you need to give us information. We have no idea what you're making your decisions based on. All right, the federal guidelines call for one of two things to move to the next step, either a 14-day declining trend in total daily cases or a 14-day declining trend in the percentage of tests that are positive. All right, I can't find that data anywhere for Platte County. All right, but we have so few cases that it would be nearly impossible to have a steady downward trend for 14 days. Not gonna happen. So give us the exact metric and give us the data that you're using to track that metric and make decisions, or we'll assume that you're trying to hide the information from us. Simple as that. Give it to us, or we'll assume you're trying to hide it and trying to have a lack of transparency like you have been doing with these meetings, okay? But again, I request that you eliminate all this hassle, uncertainty, and damage that you're causing to the community now. All right, this is your problem now, okay? Revoke your order immediately. Tell us and let us operate under the state's order, right? You said it was the same. So just, you guys do fantastic work in this county. We're proud of that. But you're out of your league when it comes to managing the shutdown and our local economy and our way of life. And you have more important things to do that are being ignored. We all know that. They're being ignored. Suicide, all those other things. If Platte County had higher than average numbers in cases and fatalities, I could see having your own guidelines, but that's not the case. It's not the case. We don't have a crisis in our county. We never did, and we never will.
Okay.
So I'm calling on you tonight to revoke your order immediately. Thank you.
Right. Thank you, Scott. We'll, I think one thing we can help you with is the website, and we'll, Dan says he'll reach out to you tomorrow.
I mean, what is the excuse for not having data on the website? Have you seen?
I think it is there, Scott. We just need to help you see it better. It is there. Thank you.
Now it's Janet's turn.
Okay, Janet?
Hi, my name is Janet Stark, and I live at 15755 Northwest 130th Street, Platte City, Missouri, 64079. And I am a Platte County resident of 16 years. What is essential? That's my talking points tonight. The dictionary defines essential as something basic or indispensable. I believe that there are three things that are always essential. First are civil liberties. Second, civil liberties and constitutional protections. Second are freedom of religion. And third are jobs. Benjamin Franklin said, those who would give up essential liberty to purchase a little temporary safety deserve neither liberty nor safety. We've heard a lot recently in this pandemic of what is deemed essential. Government, which supports separation of church and state, now demanding the closure of our churches in the name of safety and public health. Our civil liberties are indeed essential. Churches have always been on the front lines of society in times of crisis. They promote spiritual well-being, assist in providing physical food and aid to those vulnerable. They serve the emotional needs and help our communities in numerous ways. They should not be treated as non-essential. When can we expect to see them open 100%? That's my first question. We are admonished in the Bible, do not forsake the assembling of yourselves together in Hebrews 10:25. Churches are absolutely essential. Sheriff Bianco said it well on Fox and Friends, and I quote, government ordered residents into their homes, closed their businesses, made them wear masks, forbid them to go to church, and violated their constitutional freedoms put in place over 200 years ago. He went on to say that in the name of public health crisis, our civil liberties and constitutional protections were placed on hold. I refuse, he said, to make criminals out of business owners, single moms, and otherwise healthy individuals for exercising their constitutional rights. The original projection and fears that caused such extreme measures have now been proven wrong. It is nothing like they told us it was going to be in the beginning. It is time to get back to opening up our businesses. It doesn't make sense anymore. Every job is essential to someone, end of quote. We have 36 million unemployed people now in America, and many of those jobs won't be coming back. I read just today on Facebook of a local person just downtown Platte City, veteran, his business closed. Businesses are definitely essential. We have lost now over 91,000 individuals in America to this virus. I don't need to tell you that. I'm sure you're more up to date on the numbers than I am. And we were told that we could lose 2.2 million people from the expert models. Thankfully, thank God, the London Imperial College COVID-19 study was grossly overestimated. We heard things of what we needed and had to do to save just one life. But interesting enough, in the last 2.5 months, I agree, we should save every life possible. But in the last 2.5 months, we have also lost 28,000 babies because abortion clinics were deemed essential. Thousands of others with heart disease and cancer treatments and mentally ill patients that would need assistance. Others with non-medical procedures were put on hold, but their health should also be considered. We need to relook this for the future. And in conclusion, the Platte County Health Department should reconsider what is truly essential to the spiritual, physical, mental, emotional health and well-being of all its citizens. It is time to fully open our churches, our businesses, and give the American people the credit to use their own common sense to do what is right for their own families' health, their businesses, their churches, and our communities. Thank you.
Thank you very much. Okay, Paula Owens.
Yeah, I'm here. Can you hear me? Because there's a lot of background.
Yeah, I know.
Yes. Yeah. Okay. Hey, I'm a Platte County resident. I live in Parkville, and I'm also a Platte County business owner. I happen to be in the wedding business, which means that all or most of our business for the last 2 months, well, actually, really from March until some brides through August or even October have either, canceled or rescheduled. And, the reason being that brides, for the most part, can't just reschedule all the businesses that are involved with them for their weddings. And so, these brides plan their wedding, which happens to be one, if not the most significant day of their lives, 8 to 24 months in advance. And then, not just, if I was the only business involved with them, that'd be one thing. But normally, I mean, they're looking at 5 to maybe even 10 or 15 other businesses involved with them, and to renegotiate in such a short period of time on a dime is impossible for one. And then on top of that, most of these businesses, or a good number of them, are businesses that are small, if not one-man shows, basically. And so they count on this industry really, whether it's for their family livelihood or even their personal livelihood, and a lot of them are going out of business or seriously struggling at the moment. I think that what I would like to see, and I understand, I really appreciate a lot of, the passion of some of the people on here and a lot of what they've shared, particularly about our rights. And I do understand that there was concern beginning, in March and in April, and that I would say nearly 100% of people were like, okay, I'm willing to lay down my rights for a small period of time for the benefit of people at large. But really right now, especially for a lot of these, people I'm dealing with on a daily basis, tremendous emotional stress, tremendous financial stress, and they just want some concrete answers. So for instance, I'm just going to refer
We lost you, Paula.
to page 10 of Sunday's COVID response, reopening, and recovery plan, and to step 2. And instead of it saying, hey, this are the steps we're going to take as of June 1st, it says steps may be allowed to begin as soon as this. And so I think that the vagary of this is really difficult for businesses as a whole, but particularly in my business, because none of these, brides, mothers of brides, families, people have to, there's so much involved that they can't plan even. And so I think that, we can live with some boundaries, but we really need to have some concrete answers and concrete dates moving forward. That's really what I would like to see happen. And then in the long run, I know that these decisions were made out of crisis, but I do really think that you need to consider the precedent that has been set here, and you need to consider it for the long haul, and what it is set for the future of just even the county in the next year or two, but also down the road for the next generation. Because I think that, throwing rights aside is a really bad precedent, period.
Okay.
So That's all I have to say. Thank you.
Okay. Next is Jerry Lottie.
I'm here. Can you hear me?
Yes.
Okay. So I want to pick up a little bit where Paula left off. And I want to talk a little bit about businesses and about children. So I'm a business owner in Riverside. I live in Smithville now, but I used to live in Parkville. But I own a business in Riverside, and we serve about 700 families of children in our business. So we serve the lowest risk population that there is. And I want to start off with just a couple of things that have actually just been released. So just today, the CDC put out a statement saying, and I'm going to read exactly what it says. The CDC now says coronavirus does not spread easily via contaminated surfaces. So all this contaminated surface worry that we've been going through is now being told to us that it's unnecessary. I'm sorry, can you still hear me? I hear noise.
Yeah, I can.
Okay. The second thing I want to hear, or I want to say, is the renowned Dr. Scott Atlas of the Hoover Institute put out a statement yesterday saying that children are at 0.02%, not 2%, 0.02% at risk of death from COVID-19. The seasonal flu has killed almost 600 kids more than what COVID has just this year. That's just the seasonal flu. So I just want to start with that. The next thing I want to bring up is I want to talk about how important sports are to our children, to their health, their physical health, and their mental health. There was a board meeting last Tuesday with the county health board, and like 8 minutes was spent talking about the worst risk population, and that's the elderly. Over almost an entire hour, 45 minutes or so, was spent on how can the board take away youth sports from our children. Now, at the end of that, there was a comment made, with all due respect, Dr. Hills, who said, let's just put this on the table because what does one more week matter? Well, Dr. Hills, again, with all due respect, I want to tell you what one more week matters. One more week means, is that the day that the little 14-year-old boy down the street is going to start looking at pornography on the computer because he's so bored because he's got no outlet? Is that the day that the little girl down the street is going to start vaping because she's got nothing else to do with her time? No school, no sports, no activities. Is that the day that I'm going to have to shut my business down because I can't afford to stay open anymore? Is that the day that I'm going to get my car repossessed? Am I going to be able to buy groceries for my children? Yes, one more week matters. And your lack of compassion to the people of this county was very disturbing, very disturbing. With that said, I want to move on and explain to you how your rules and your restrictions are affecting my business. Not just my business, but the businesses of all the small businesses in Platte County. We're expected to run our business either on 0 or 10% of our income. That's unacceptable, especially when we can see the evidence that the risk is no longer there that we thought it was in the beginning. So my question to you is, when are you going to remove those restrictions so that, number one, businesses can get back to work, employees can get back to work, and far more importantly, our children can get back to being children? Right now, our children are collateral damage in this whole thing. Thank you.
Okay, thank you very much. Sorry about the echo. Kelly? Kelly Piper? Are you there, Kelly? All right. Gail, I'm not sure how to pronounce the last name, Breaky? Gail, are you there? How about Tammy Thompson?
I'm here.
Okay, go ahead.
Hi, thank you for this opportunity. I'm a 40+ year resident of Platte County. I live in Southern Platte County, and I've spent 20+ years as a community pharmacist here in the county. I wanted to speak today to voice some of my concerns regarding the order to reopen the county. It was my understanding we were sheltering in place to flatten the curve and not to overwhelm our healthcare system. We'd done that weeks ago, and now the goalposts have moved. We flattened the curve and did not overwhelm our healthcare system. Here in the surrounding metro, we've actually caused hospitals to cut staff and wages in the areas of low census in the area because of their low census. I've actually known friends of mine that are other pharmacists that have lost their jobs or had to take a pay cut because of the hospitals not having enough patients. But I imagine when you signed up to be on the Board of Health, you had no idea that you would be put in a position to making these kinds of decisions that could mean life or death. This is the first time in our history we've quarantined the healthy. I was a pharmacist here in the community during the 2008-2009 H1N1 pandemic, and that affected everyone of all ages, but I don't recall any type of mitigation being done during that time. It was life as usual. Maybe we just promoted the flu shot a little bit more frequently at that time, and then there was actually a flu shot shortage because more people were getting their flu shot at that time. But we have yet to know what long-term effects the shutdown is going to have on our county, from the economic issues, the undiagnosed cancer, heart disease, and diabetes that may be out there, the delay of care and other chronic diseases and cancer treatments. People aren't getting what they're supposed to be getting. Vaccines are behind because people aren't taking their kids to the pediatrician. As a pharmacist, I make decisions every day by weighing the risk versus the benefits of a therapy for a patient. This is thought process with what needs to be considered when evaluating the restrictions put in place for COVID-19. I ask you, how many businesses can survive a 2-month shutdown only to be able to have 10 to 25% of their business be occupied? And I just don't understand what the logic is of that, because here in Platte County, I don't know if any of you board members actually went to any of the stores that were here in the county that was allowed to be open. They were full every time I had to go, and I was a good citizen and only went grocery shopping like every 2 weeks. And I only went to one store, and it was always crowded. And there wasn't even any occupation restrictions put on those stores until just recently. So during the height of this pandemic, when we didn't know who it was affecting and what was going on, there was all kinds of people all over the place. But yet we still have very low amount of cases in our county. I think we could be, if we had only shut down for maybe a week, maybe 2, to allow businesses to address safety and distancing in their businesses, we could have let them open back up, and we could be at phase 2.3 by now. So this leads me to what my concerns are. I have issues with it until a vaccine or therapeutic interventions become available. Some level of physical distancing will be required. We don't know if there's going to be a vaccine or how effective it will be. So what happens then? And then even if there is one, there's a lot of distrust with the government right now and the healthcare system. I think I gave flu shots in this county for many years, and we probably, out of my patients I had, probably had less than a 50% participation rate in flu shots. So there'll be a lot of people that won't even get that vaccine if there's one available. And then I also would like to know, what does a robust surveillance system entail? And how long does it take to get one? And do people want one? And then there was, to get to phase 3, there has to be minimal active cases. So what is your definition of the minimal active cases? And let's see, so I had to since this got postponed, I looked up the website. I guess we have 110 cases, including the KC metro area now. So that is 0.1% of our population. So what percentage would you consider minimal, and would you consider a surge, and what would you consider a surge and have to reinstate mitigation efforts again? This is information that we need to know. And I appreciate that you finally started posting how many tests were administered and how many were positive, but you can't tell, there's not a graph to tell you if there's a downward trend. So that's the number we need to look at, not just total cases. And again, I would also like to know hospitalization rates, but maybe we don't have anyone in the hospital. I don't know. I did see today we had the 1 death. And finally, I would like to put some perspective on this. Since this pandemic started in the middle of March, I've known of 3 Platte County citizens that have lost their life. And none of them were to COVID. So I'm sorry, one of them was a family member.
I'm sorry.
And so I think it's time that we start weighing the risk versus benefits of keeping this county at phase 2.1 until June 1st. Thank you.
Okay, thank you very much, Amy. Okay, Russell? Not sure how to pronounce it.
I'm here. I'm here. Do you hear me?
Yes.
Okay, thank you. Thank you for letting me speak to you tonight. Everybody else has given their address. I'm a 35-plus year Platte County citizen, be 36 years this October. I live at 5014 Northwest Woody Creek, down in the extreme southern portion of Platte County and Misty Woods area. The citizens of Platte County, and I would say that it is safe to say that they feel being robbed of their liberty and rights, and that rampant government overreach has been propagated by a county agency. We have since found out that the election of the County Health Board has not been particularly transparent. As I said, I've been here over 35 years, and I never remember voting for a Platte County Health Board member. And that is my fault, and I'm embarrassed that I never voted for one or didn't know about this. But I found out that if they're unopposed, they never appear on the ballot. So we never knew that there was that election to be held. This is absurd. I am working. I have contacted the Secretary of State's office today, and I'm looking to try to see if we can't change this unless you guys change your rules initially. At least put your name on the ballot, opposed or unopposed, because it's just not fair otherwise. As you've read in all the public comments and heard here today, mostly, I think many citizens in Platte County are very unhappy with your decisions. The advisory board does not represent a competent cross-section of retail, hospitality, and various business sectors within Platte County. None of the large restaurants are represented. Nick and Jake's, Roxanne's, it has 2 locations, tavern owners, manufacturers, contractors, and I'm afraid that the list I saw of the advisory members, most of them probably haven't lost their jobs and been getting a paycheck. Unlike me, I lost my job, my part-time job from Enterprise, among many people, and the 36 million across America that also lost their jobs. My 2-week notice for it had old dates and old statistics. Now we're up to 105, and sad to say, it sounds like we've had 1 death. That is quite regrettable and very sad, but it still only accounts for about 0.1% of this county that has been affected with this virus. And I would bet that we lose more people in car accidents, opioid deaths, drug overdoses, possibly even murders, especially in the Kansas City, Missouri area, than we do of this virus. We need to open this county up today. I mean, do it tomorrow morning. Let the businesses decide how they want to do social distancing. Let me as a free citizen decide if I want to go into that business or not, or mingle with people and social distance or not. I mean, quite frankly, I'm not afraid of this virus. I'm 61 years old. I'm probably barely on the bottom edge of the more vulnerable, but I'm healthy. I don't have any other outstanding medical issues. It's time to open this up and let free people make the decisions for themselves. This this being made decisions, especially by unelected people that work for the health department, is just out of control and needs to change. So that's all I'm going to say. I'm going to post my my actual comments online, but you've heard the same thing over and over. Open this up tomorrow morning, frankly, and let's hold meetings in person, and let's make the elections transparent so we can get a board that knows and takes control of this and takes control of the people that we hire, the taxpayers are paying for. Thank you.
Thank you. All right, next is Abby Olson. Abby, are you with us? I was the same.
Yep, she's here. She's here. Sorry.
Hi.
Okay.
I saw that Russell didn't have internet access.
Oh, okay. Got it.
And so I invited him to come over and do it with me. So,
All right.
Also, I wanted to address the board. I want you to know that I am sure every single one of you, I'm serious about this, are very, very nice people. And this is nothing against any person. This is simply a pushback against the board's rulings, and I just felt like I had to speak up about this. As many people mentioned, when we first started with this months ago, we heard we needed to flatten the curve and that we needed to stay home and social distance and so on and so forth. And I think all of us said, oh, this is a terrible disease. I mean, we were looking at Italy, we were looking at Spain, you know, the figures were horrible, 14%, you know, and so on and so forth. And we said, yeah, it makes sense. It makes sense. Let's not get this. Let's not spread it. Let's stay home. So we all voluntarily acquiesced and we all stayed home. At a commissioners meeting, however, and I wish one of you could have come to that because it was, I thought, very enlightening. But I heard one of the smartest things I've heard. A gentleman got up and said, if we knew then what we know now, would we have closed every business? Would we have closed our schools? Would we have closed everything? Maybe in New York, New Jersey, but would we have done it, you know, throughout, especially like Platte County? I don't think we would have. I don't think we would have at all because it doesn't make sense. And looking back at the new information and so on, especially in Platte County, I don't think it makes sense anymore. And also for a citizen, our trust kind of dissipated when we learned that there was faulty information, there were bad models, and many, many, many medical disagreements. I personally have made over 250 of those little masks because I was told Platte County needed them, and the social services needed them, and I've given them to Casey Hospice and all sorts of places because we were told masks. Well, first we were told masks didn't do any good. Then we were told masks did do good. I'm hearing 2%. It stops 2% of the virus. I've heard it stops 95% of the virus if both people are wearing them and so on. We don't know what to believe anymore. So we have to go off of what makes sense. And it just basically no longer makes any sense for us to look at this as an either or. Either we can be safe or we can all, you know, open up and die is basically what we're hearing. I am a vulnerable person. I will choose to stay home. I'm a smart person. I think Platte Countyans are very smart people. I will stay home whether we open up or not, but that's a personal decision I would like to make. It seems as though we either have to give up our liberties because it's mandated, or we have to become civil, disobedient people. And I don't think any of us want to do that. When the Missouri guidelines opened up, Platte County, who should have been the poster child for why we should open up, you know, very few illnesses and percentage-wise, and at that time when there were no deaths at all, we should have been, yeah, this is the reason why at least Platte County can open up. Even St. Louis has opened up, and that was our epicenter in Missouri. But no, from what I hear, the board is saying we can't open up until there is a vaccine, or open up fully until there's a vaccine. And that's much too long, and it just doesn't make any sense. In my opinion, the board's priority should be to see how we can protect the vulnerable. All the vulnerable have ever heard is stay home, stay home, stay home. But do you know what social isolation does to people? I saw some statistics. There are many, 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 but just one I'd like to share with you, because they followed some 32,624 healthy men. This was the Aging Life Care Journal article, and the author was Clifford Singer, MD. But they followed these 32,000 healthy men. Those who were socially isolated had 90% more risk of cardiovascular death and more than double the risk of death from the accident or suicide. They also had double the risk of non-fatal strokes. This is a health issue too. Not allowing people to get out and meet and congregate and things of that sort is also a health issue. It just no longer makes any sense. And you're going to lose, if you haven't already, you're going to lose the consent of the governed. Thank you for listening.
Thank you very much. All right, Joe Becker.
Yes, I'm here. Thank you very much. I appreciate the opportunity, and Director, thank you, as well as the board. I'm Joe Becker. I live at 14235 Northwest 62nd Place, Parkville, Missouri, 64152 with my wife, Linda. We've been residents of counties for 15 years. I have a bachelor's degree in engineering, a master's degree in business administration. My wife has a bachelor's degree in education, a master's degree in library science. We truly appreciate the quality of life we have in this county and the educational and all the events and opportunities that we have. I want to encourage the director and the board to accelerate phase 2, all the steps, and reach phase 3. The board's directions and decisions to open our county so slowly is destroying our county's quality of life. Platte County Health Department closed our county to this COVID event, and for discussion purposes, I'll just say that you forced a third of our businesses to close. You forced a third of our workforce to work from home, and you left a third of us deemed essential, including liquor stores. Platte County Commissions in January approved a budget of $31 million against an expense budget of $27 million, to the best of my assessment of their multiple page budget that's posted on their website. Only thing posted on the Platte County Health Department's website is a little glossary of their report, the annual report, with one sheet that notes their revenues and where they come from of approximately $3 million. My point is that the Platte County Health Department, Parks and Recreation Department, Fire Safety, Security, and the responsibilities of the general county commissions, they all get their revenues from either sales taxes, property taxes, or various use taxes. It's my opinion that Platte County Health Department, the Education Department, the Fire Protection, the Safety, as well as the Platte County responsibilities to run our whole county, stands to lose a significant amount of revenue due to this COVID-19 and the actions taken by this committee. Platte County Health Department and other county agencies are going to be required to cut their budgets. Now, the county health department runs a lot on property taxes, so you will not have that impact for a year or two. However, current commission and other divisions will have some impact because our revenues are going to be down. It's my opinion that the federal funds that we get will be helpful, but they're just a temporary bridge. That's all they are. It's also my opinion that area businesses, vacancies such as areas like Zona Rosa, vacancies in strip malls, and also vacancies in our downtown city areas will send our whole community into a tailspin for collection of revenues. Any delay or restrictions in openings for our schools, for our sports activities, for our educational processes will compromise the prestige that we have in our community education rankings. I feel that poorly operated schools, no sports activities, and lack of a really desirable and accessible needs and services and businesses will drive down our home values and will change our school rankings. The Platte County Health Department's decision to restrict business, sports activities, and schools fully opening is going to leave our community with declining assets, declining revenues, and it'll translate into a loss of services for you, the county health department, parks and recreation that we cherish so much, including YMCAs and such activities. Education is going to suffer the benefit of that decision of yours, as well as our fire and our safety providers, and then general services provided through our commissions. So I'd like you to please consider the legacy that you are leaving your community with these decisions that you're making regarding this COVID-19 event. And please accelerate phase 2, step 3, and phase 2, step 4, and get us to phase 3. Thank you for the opportunity.
Okay, thank you, sir. Okay, Rita Wise. Rita, are you here?
Yes, I'm Rita Weezy, and I live in Southern Platte County, 64151. I also agree with many of the comments that have been made and would like to add to them. Day after day, we get new information. Yesterday's truth is not going to be what we're going to hear as the truth for tomorrow. And even science has been hijacked. There are a lot of people now that are speaking out with epidemiology degrees, but they are being silenced because of Facebook and the internet. So we are not getting all the information that we need to be getting. I've also lived in Platte County for over 20 years and don't remember ever seeing that there was a vote for the health department on my ballots, but maybe I've overlooked some corner of the ballot where I should have looked. But I also think that it would be more clear if those who are on the health department would be on the ballot so that we know who we're voting for. Also, I think that the war on the American people, waged with lockdowns and social distancing and masks, makes the American dream disappear. What took the Great Depression 3 years was accomplished in a matter of 3 weeks. Small business has collapsed. 80% of jobs stem from small business. What we do is a big part of who we are, and it's dehumanizing to be non-essential. In the name of safety, the healthy have been quarantined along with the sick. In the 1900s smallpox quarantine, the sick were isolated, but those who were healthy went to work. This shutdown prevents parents from being with a child in the hospital and loved ones, especially the elderly, from having visitors. The collateral damage is huge. When did we go from flatten the curve to make sure no one gets sick? There is no right not to get sick. That's natural. And waiting for a vaccine curtails our freedom for a much longer period of time. How long are the trials? We can't rush those. Who stands to gain? Notice who is funding Big Pharma. Notice which of the doctors who tell us what to do have gotten onto vaccine boards. And I think maybe we're confusing these advisories with laws. I don't know whether the laws are in place without the people's consent. How do you quantify risk? Why doesn't the Platte County COVID count tell us how many have recovered instead of just how many are sick? Elective procedures are a bigger risk than a virus. Yet those who had elective surgeries canceled or a test for a tumor or cancer delayed face a greater danger. When hospital beds are empty and nurses and doctors are furloughed, this has become political. It's not about safety. Freedom is the Marine in Sacramento, Dr. Williams, who dispersed 200 riot police and said, an order that is not moral or ethical does not have to be obeyed. Freedom is the barber in Michigan, Carl Menke. He took a risk, and for every haircut he gives, he pays a $1,000 fine and a year in jail. Few Germans talk about the past in Germany. The government is asking Mankey to get in the cattle car. His fight for freedom is for all of us. Who takes the responsibility and the risk? It's we the people. It's called freedom. With courage and trust in we the people, you can revoke all the regulations and please open the county. Also, in the future, hold the meetings in person. This is so impersonal that it's really hard to be able to see who we're talking with and to look each other in the eye. Thank you.
Thank you. Thank you. All right, Mary Goodman. Mary, you still with us? Mary, do you want to hear Mary? All right. Yummy, hand healthy?
I'm here.
Good, thank you.
Can you hear me?
Yes.
Okay. First of all, I want to thank you for your service in these trying times. The constitutions of both the state of Missouri and the United States recognizes that people have natural rights given to them by God. According to both constitutions, the purpose of government is to protect these natural rights, which include life, i.e. self-preservation, liberty, and the pursuit of happiness. The purpose of government has never been to protect people from every disease and risk in life.
I don't know if that's me or you causing that.
Okay, I'll continue. Section 2 of the Missouri Bill of Rights. Okay, is there some reason to echo?
Can you turn down your volume some way?
Okay, can you still hear me?
I can hear you, yes.
Okay, let me try that again. Can you hear me?
Yes.
Okay, does my volume need to be muted?
Well, just try it with it down and see if it does better.
Okay, I think it's maybe is it your volume?
Well, I can turn mine down. Mine is down.
Okay, I'll
Dr.
try.
Jackson,
I can't hear you.
you could mute your PC and Lubert's PC. It might help.
Pardon?
Mute Dan's PC. That might help while other people are talking.
Okay. Go ahead, see if it helps.
Okay, test.
Yes.
Okay, let's try it again. Okay. Section 2 of the Missouri Bill of Rights states that when government at any level fails to recognize and protect the natural rights of its citizens, it fails in its chief design. Let me ask you a question. When you go to the doctor and he gives you medical advice, if you decide not to follow that advice, do you go to jail? That's the situation here. You are the doctor and Platte County is your patient. Your medical advice is becoming law. That puts you in a lose-lose predicament. Some people will blame you for not keeping them safe. Others will blame you as their livelihoods are being destroyed. You may think you only have option A or B, but I'm here to tell you that you do have option C. Before I explain option C, let me interject this. The first 5 words of the United States First Amendment, almost verbatim in the Missouri Constitution, says this: Congress shall make no law, and it lists 5 things which must not be prohibited. These things include the free exercise of religion and the right to peacefully assemble. Furthermore, the Fourth Amendment acknowledges that people have the right to be secure in their own homes, protected from unreasonable searches and seizures. The amazing thing about the Missouri and the United States constitutions is not that they give us rights, but they recognize human beings have natural rights given them by their creator. And it is the job of government to protect those rights. It is the job of government to protect those rights. So here's your option C. You can choose to honor and uphold the very core of the Constitution of the United States and the Constitution of Missouri. If Congress shall make no law prohibiting such things, surely Platte County Health Department has no authority to prohibit such things, yet, or to make any law for that matter. You could issue a statement that you recognize the people of Platte County as a free people capable of making good decisions for themselves and for their families. Therefore, the people should decide for themselves. You do not have to take on this absurd liability and let anyone push you into becoming an unconstitutional legislative board, because that is what's happening. Again, thank you for your service, and I believe you will make a good decision. My prayers are with you.
Thank you very much. Is anyone that was called out before that was listed to speak, that didn't get to speak, present now? Okay, hearing none. All right, we'll move on to our, thank you all, yes, again, for your comments. And we'll all be listening to this again, and if there's anything we can do to try to help you all, we will. Next on our agenda is old business, is COVID-19 update.
Thank you, Karen.
Karen? Sorry, I see you all. Are you there, Ed?
She's here. She muted. And she muted.
She's not muted. Just unmute yourself.
He has you unmuted. You have to mute yourself.
I do apologize again. This is a terrible way of being, but this is all we can do today. Sure. We're gonna ask Aaron to come to this.
She can come to the hallway, her computer off. Would that help? Could you turn yours on?
Public comment section?
That was it. What was the question?
Would the board like to respond at all, or?
Well, we will. We just need to, we have to get our thoughts together.
Hi, Dan, I'm here now.
Okay.
Turn your volume all the way down.
Okay, go ahead, Aaron.
Can we get some sort of public statements from the board or the director? I mean, we've spent a lot of time here letting you know how we feel.
We'll make a statement.
You turned it off. Yes.
Can Michael Porter please be allowed to speak? He's here. Is that it? So they left. Unbelievable. That's it. I'm embarrassed.
That's the end of the meeting?
The meeting is still in.
Hang on.
Appreciate all your comments. Sad deal. They left. They just left.
No, we're still here.
Are they coming back?
Hey, dear.
It's all right. It doesn't matter, I guess. Whatever.
They're still here. You just can't see their video. They're sharing their screen.
Oh, okay.
Okay, can you hear me?
Yeah, I unplugged it. Dr. Jackson, can you turn your computer off and then use this?
Use Dan. That is yours.
All
right.
Can you anyone hear?
I can't.
Is there any other electronic devices?
My clear down.
What you voting on?
Okay.
You try.
Can we find it?
Whoever's not speaking, if you can mute.
Where's Aaron?
Dan, are you ready?
Anyone hear us?
Go ahead, Eric.
Okay, thanks. Can you mute yourself, Dan? I think you're giving some feedback. Okay. Great. So as you can see on the report, here's some updated data from today for Platte County. So far in Platte County, we've had 113 cases reported. 4 of those are outside of Kansas City limits, which means they're in Platte County Health Department's jurisdiction. And 49 cases are in Kansas City city limits, which means the Kansas City Health Department investigates those. So for one, I'm going to mainly refer to those 64 cases because those are the ones that we've been investigating and that we have on. And so in the last 2 weeks, we've had 26 cases reported. That's since May 7th. And that is the most cases we've seen reported in a 2-week time period since this has started. Okay.
Okay, but acknowledge that there's been an increase in testing, would you, please?
Okay.
I mean, not in the meeting.
I'm sorry, we're making sure that everybody can hear us. Okay, thanks.
Yeah.
Okay, can someone from the public please let me know that they can hear me speaking?
I can hear you speaking.
I can hear you.
Okay. All right, thank you. Okay, Aaron?
Okay, so continuing with what we
Is the
were,
public hear Aaron?
can you hear me?
Can the public hear Aaron?
Yeah.
Yes.
Okay,
Yes.
go ahead. Okay.
Okay, so continuing with the case, talking about the cases, we've had 26 cases reported in the last 2 weeks. It's obviously not something we didn't hope to see, but it is not something that surprises us. As we have opened up and people are slowly going out and going about their business and doing things, and as we have increased testing in the region, and we'll give some testing data in a couple of slides. And we will add that some of these cases are associated with outbreaks. So we have 9 cases in association with the outbreak at Riverside Nursing Home and Rehab. Also, 4 of these cases are all in one household, so that's not an outbreak, but it does kind of elevate the number of cases if a bunch of cases all test positive in one household. And then we've had 5 additional cases of these last 26 that have had exposures to confirmed cases at home or in a workplace. So we know that there are quite a few workplace outbreaks going on around the metro based on conversations we've had with other health departments. So it's a good example of how people in Platte County are going out to their workplace of work, maybe even in other jurisdictions, and maybe exposed there. So do you want to move to the next slide, Dan, please? And then some data on hospitalization. So of our 64 confirmed cases, we've had 14 hospitalizations as of today. Those ages have ranged from 20s to 80s, and 6 of them are still hospitalized as of our last contact with them. And then as of May 20th, we have sadly had 1 death reported due to COVID-19 in a Platte County resident. And there have been 180 deaths reported in the Kansas City region. And that's from data from Mark as of yesterday. Next slide, please, Dan. And then these are some regional rates from Mark, and you can see that, again, Platte County, we are very blessed in that we have not had the numbers of cases that we've seen in some of the other jurisdictions, like Johnson County or Jackson County, Missouri. But we have seen that our rates, so the rate of cases we've had for our population, is pretty similar to a lot of the other jurisdictions. Such as Jackson County outside of Kansas City, Johnson County, Kansas, Clay County, we're pretty in line with those areas. Now, more populated areas like Kansas City obviously have had higher case counts, and then places like Leavenworth and Wyandotte, where they've had really large outbreaks, are also seeing very, very high case counts for their jurisdictions. Next slide, please, Dan. And then here's some testing data. So testing has increased quite a bit over the last few weeks. This is data we just started getting towards the beginning of May from the Department of Health and Senior Services. Before that, we were not getting any negatives data, but now that's finally starting to come in. So we are able to do some analysis on that. As of May 19th, we had a total of 886 negative tests that have been reported in Platte County residents. And that's all since March. So overall, if you include those 64 positive tests we have a 6.7% positivity rate in Platte County, 9 Kansas City residents since March. However, we have seen that rate gone down as testing has increased. So since about the 2nd week in April, we have had rates below 5%, which is a good indicator that we have sufficient testing in the county, and that we're really having good testing. And so you can see that the week 19, epidemiological week 19, which is the week of May 3rd, we had a positivity rate of 4.8%. And hopefully we'll get that data in for this past week and pretty soon. Unfortunately, it does take time for the labs to report that and for the state to send it to us and to clean and analyze the data. So data does take time for us to complete and get those results in and be able to share that information. Unless the board has any questions.
All right, thank you.
Thanks.
Comments from the public? From the public? There was a question asked about if we were going to make a comment about the public comment we heard, and I did take notes about them. I will be listening to the recording again, and we will be forming some answers to those comments as soon as we can. Did anybody hear me? Public hear me?
Yes, sir, we heard you.
Okay, thank you.
Yes, we heard you.
All right. So the next item on the agenda is the Platte County Fair.
That's mine. I was called to listen to them. And they're wondering what we're going to think about having a fair. And so I explained about the distancing requirements and all. And it's the third week of July. So, and they wanted to know if there were going to be more guidelines coming out about those kind of crowds. Are there?
Well, the next phase allows for 250 people, so that's a far cry from the Platte County Fair usually. Right. You know, part of the problem, and I know some folks were saying they, you know, would like to have more specific data. Well, when you're dealing with a virus, and we have to watch our all of our data and our statistics, you know, to be able to give any kind of hard and fast data. So,
what I think we should say is that as time goes on, every 2 weeks you're making a step in the phases, and every 2 weeks is when we can look at the data again and decide how we can proceed with the next phase. Is that correct?
Right. Okay, so that 2 weeks would be when?
June 1st is the next potential step.
Right. The next step is scheduled to change at June 1st.
Okay.
So we'll see. That's just a few days away. We'll see what the data is.
Right.
On us by then.
Okay, so I'll just tell them that.
Yeah.
Yeah.
All right.
They're not upset or anything. They just want to follow the rules.
Well, they need to know the rules so they
Right.
can follow them.
Right.
All right. Youth sports.
So I wanted to give an update. First, I'd like to apologize to the public. We had some obvious technical difficulties. It was related to too many electronic devices in the room, and I'm sorry it didn't get resolved sooner. I'd also like to say that we, in addition to the board, the staff have heard your comments, and we certainly will try to answer some of those questions that were brought up, as many as we can. Part of the challenge, as I'm sure you all know, is keeping information updated, but also accurate information, and trying to anything that has a political lean to it in any direction. We want to make decisions based on data using CDC guidance, and that's what we have available to us. The CDC, the World Health Organization, and Missouri Department of Health and Senior Services. So, but with that being said, I want you to know that these plans are reviewed constantly, and we realize that we're not capable of perfection, but we're trying to get the best information we can as soon as we can. As Aaron mentioned, the data about positivity rate, which is a set of data that we use, the 7-day moving average positivity rate. Rather, the number of cases is relevant because each one of those cases is a human being. And we have seen an increase in the number of cases that are being reported to us. And I can assure you that those numbers are not just because of more testing. Those are not to additional testing, they're just additional cases. Regarding youth sports, we have received some great communication with Kristen Davis, the Vice Chair of the Platte County Sports Commission. He has reached out to us and really appreciate the approach. She wants to take a very positive approach. working with us to develop a plan moving forward and kind of a central repository for sports organizations. As you probably know, Platte County actually is the most lenient jurisdiction in Platte County outside of Kansas City, is the most lenient jurisdiction when it comes to youth sports in the metro area. I think that, as I said, we're working with Ms. Davis, and there were some other folks who were very, very instrumental in communicating with us about youth sports. And based on some of that communication and the data that we've received, changes have been made to youth sports and putting up some practice availability as well as the competition beginning June 1st. Ms. Davis, as I said, she's with the Platte County Sports Commission. She volunteered to be our liaison to those groups that will be the sports groups who will be submitting plans. Now, under our order, food establishments are required to develop plans and submit those to us. Sports organizations and other businesses are asked to create plans, reopening plans, but they are not required to submit those to us. Ms. Davis, however, has offered to be the liaison for create those plans and then submit those to us. And we'll what we want each organization to do is take responsibility and develop their own plan based on industry guidance. And as you all know, there are a large number of youth sports and sports associations available that are providing that guidance. In fact, today, Ms. Davis submitted some universal recommendations to the youth organizations in Platte County, and those universal recommendations would be regardless of sport. And we have reviewed the universal recommendations, made a few suggestions, they're good, and will be shared with youth sports organizations. And again, I want to stress that youth sports organizations and businesses are expected to follow their industry guidelines to create those reopening plans. So the responsibility, it is really is a personal and corporate responsibility thing is what we're looking for. I did want to let the board know that I've received communication from Daniel Erickson, Platte County. He's the Platte County Parks and Rec Director. If you're not speaking, could you please mute yourself?
Hey, Dan, I think you need to mute all callers.
We're having trouble doing that. I just want to make sure more than anything that public is hearing us. And if you can't mute yourself, please do. Can someone tell the public respond if you can hear me?
Yes, I can hear you. It's cutting out when the callers cough or make other noise.
Okay, I'll continue. Daniel Erickson, Platte County Parks and Recreation, sent me a message. He's been contacted by KC Sports, which is the company that runs most of the baseball tournaments in Platte County, but they were seeking to schedule, or are seeking to schedule, Platte Ridge Park for May 28th, which of course is before the June 1st date that would allow for competition to begin. He's aware of that, but he did offer to inquire about moving that date forward. I think the board has already a similar request. I just want the board to be aware that this request was made. And then we also received a request from the Main Street Parkville Association about their annual Parkville 4th of July celebration.
Guess what?
And so just want to make the board aware again of this, that we do need to make a decision on, and I'm not prepared to make a recommendation. I don't think Mary Jo is either at this point, but make a recommendation about crowd size and gathering size as we move toward step 3 in phase 2.
And like your sister size shots.
Okay. Anything else, Dan?
That's it.
All right. Okay. So it's new business, Unified Facility Architect RFP. Brian, are you there?
I am, but I'm muted. Now I'm on. I should be on.
Okay, we can hear you now. Are you there, Brian?
I am.
Okay, you have something to tell us?
We have some board homework, a little bit of clerical work. I think the latest draft document was in your packet.
Yes.
No, does everybody have that available?
Yes.
So I've highlighted several items of consideration as far as getting you to the end goal. The goal is to get you the project that you want. The best possible outcome for RFPs and RFQs. Started this process originally as an RFQ/RFP. I think in consultation with council and that sort of thing, you could do it several different ways, and part of that has to do with the calendar and the time. Traditionally, you would go the RFQ route and have an RFP embedded in that. You can do that by separate envelopes. You can also do that by just putting everything in the same document. So if you have that document, I would go to the last page, which involves the calendar. And then we can work back from that, and that would set some priorities as far as how much time we have and what needs to be done tonight. Does everybody have that?
Yes.
Yep, got it.
The original intention was to try to get this to fit in between this board meeting and the next board meeting, which really compacts things quite considerably. But I proposed that, knowing that this was going to come into this meeting, that this RFP go out this week, which right now I have it as Friday. What that would mean is the building would need to be visited next week by anybody that was interested in seeing it, and I was suggesting that would be a mandated visit by anybody that would be doing an RFP, which would mean probably Dave would have to be available, or somebody would have to be available to schedule those, and we would probably space those out and not do them all at one time like we normally would do. And then we would try to get, we'd have questions the following week, and then we'd try to have proposals back in. And I have a proposal right now. The proposals would come in the day of the next board meeting. So that would mean that you would have those available to review at that board meeting as a cursory review. But I would suggest that the actual process of making that decision would occur after that board meeting, either with a subcommittee or the full board in a special meeting. But that would be something that would probably need to have some time to. So if everybody's okay with that, we can back up and go through this document, and I can go through the highlighted aspects of this document, and you can handle it two different ways. You can make a decision. Some of these could be deferred to a process that could for final editing with the staff. I don't think all this has to be a board decision. So any comments from the board at this point?
No.
So, are you actually saying that you don't think it would matter if I had?
That you don't have it. Anybody knows that. You've always giving that meeting on here. Nothing on the map. People come in and you're like a crazy person.
I don't think I'm crazy.
You do not have.
I wish you'd kill me tonight.
Oh, Stephanie, you gotta quit saying something like that. You said something about that. You said it to Georgia. You got to quit that. People think you're really nice.
You know how I am about getting the flu or any kind of sickness.
Does everybody follow me so far?
Okay, we lost you for a moment, so yes.
Yeah, I think you told everybody and I came back, so.
Yeah.
Okay, so because we have a 1 month time period and normally you would give RFP process at least, I would say at least 3 weeks. My goal and the board's goal is to get, qualified companies and design teams to come back in on this. So I wouldn't compress it any more than that. So the option would be that we could stretch it out a little bit, give a little more time, but then it would be either a full month to the next board meeting, or you would have a special session for just this topic, I would think. That's the involvement of the calendar.
Okay.
Otherwise, we need to go through this document, probably make a few decisions, or we address it at some other time.
Okay, maybe let us meet
Yeah.
with Brian and.
Yeah, I
But
think,
I'm also available here for questions. That's part of the reason I'm here.
okay. I don't know if we have any questions right now.
I'd say maybe Dan and I meet with Brian and then we try to come up with a timeline where we could.
Can you hear me, Brian?
Yes.
Okay, so we're gonna.
This is Dr. Hills, and I think that I just heard Mary Jo say that maybe you could meet with Brian and then let's go from there.
Okay.
Yes.
I'm not opposed to a special meeting. I'm not opposed to the next board meeting. I just think that, we certainly have big things going on right now, and I don't have a problem in having a special session, or if it's not that big of an issue, waiting to the next board meeting.
Okay, that sounds fine.
From my personal perspective, time is completely in your hands. I'm just trying to,
You'll have to tell us if it's not.
I mean, we have stuff that was set in motion, 6 months ago is what we have right now, but you have control over the time and the schedule on this.
Okay, all right.
And I understand, obviously.
We'll talk about it.
I'm a Platte County resident and business too, so I understand, all of this, so.
I think we table it to either special meeting or and do a special meeting after Mary Jo and Dan have met with Brian.
Okay, Kathy Hill has made a motion to table or delay talk about this till after Mary Jo and Dan have met with Brian.
Let me, before you finish that, do you want a special meeting to discuss the RFP before it goes out? Is that what you're talking about doing?
Yes.
Yes.
Okay.
So I second it.
Okay, any other discussion? All in favor? Kathy Hill?
Aye.
Paula?
She's muted. She's muted.
She has a text. That's what she was doing.
Okay, we got a text from Paula?
She said yes.
Said yes, okay. All in favor then? All right. Anything else from you, Brian?
No, I'll get back with Mary Jo and Dan.
Okay.
And we can figure something out.
All right.
I'm good.
Okay, thank you.
Thank you, everybody.
Thanks, Brian.
Thank you, Brian.
You're welcome.
Check the public again, make sure they're still hearing you.
They are. If you want to ask one.
Yeah.
Angela, can you hear us?
Yes, I can hear you.
Okay, thank you.
Mhm.
All right. So next item on the agenda is a report from the director.
All right, just wanted to fill the board in a little bit on the plan for Platte County Health Department to reopen just like the rest of the county. So Angela and Dr. Parker and our nurse practitioner, Janice Marshall, have been doing a great job working with Kat Robnett, our emergency response planner, to start getting public health services open back up, such as we've been doing STD testing and some TB testing all along, but to get immunizations starting back up so that we can get our children back on schedule to be immunized. So I don't need to go through the whole scenario, but they've got an actual several-page plan worked up as to how we're going to do that. We've had our maintenance individual put up plexiglass barriers to protect our staff. They have different things worked out for telehealth visits for family health care that they've been doing now, but to continue those. And we even talked today about possibly moving our testing operation for testing, folks for COVID-19, maybe moving that operation up here to Platte City so that we could separate the folks that are being tested from families that are coming into the clinic for immunizations. So we'll have more details worked out on that in the future, but we will more than likely need to hire some basically PRN temporary staff to do our testing because, with our nursing staff that we have opening up more immunization clinic visits and opening up our family health care visits for folks who need to be seen by our physician or nurse practitioner. We don't have staff to do both. So that's something that we're working on as well. And, the staff, if we do hire some folks to do the testing, they can be housed up here at Platte City in the basement in those offices that are vacant right now. So that will should work out pretty well. The rest, most of our time has been being spent on COVID, trying to keep ourselves updated. And, we have been working with the long-term care facility in Riverside. They've, had several additional positives, and they've been very, very good to work with. And we've had several telehealth meetings, that we've had with them. And per the board's request at the last board meeting, we did reach out to the remainder of all of our long-term care facilities, nursing homes in the county. And at this point, they have just said that they would like to speak with their corporate offices before they get back with us regarding testing. So we'll be reaching out to them again to, try to give that offer again for testing. So
I did see where the governor had said that the nursing homes were the new hotspot and that they are getting more testing specifically for all of our nursing homes. And they listed how many were in the state of Missouri and how many that they'd like to test all of them.
So we've just been very blessed and lucky to have this free testing by the donors that have provided the testing that we've been doing thus far. So it's saved a lot of people funding, and KU Med Center has done the testing for free as well. So it's a wonderful collaborative. The health department's done the labor for free, and it's the Riverside facility has been extremely grateful for that. So as I said, we're still doing some family healthcare visits via telehealth, and we did finish out our Northland Healthcare Access contract year with our visits just a little bit under 65% of our benchmark, since we're in the middle of a pandemic and not many visits have been happening. We've been seeing people that needed to be seen, but I think we've done pretty good in the middle of a pandemic. So we'll be starting a new contract year with them June 1st. So other than that, we've had a lot on the agenda tonight. You have your budget review in front of you. Our revenue has come in. We've received 66% of our revenue, and our expenditures are with 33% of the year, we've spent about 27.5% of what we budgeted. So we're in good shape there. And that's just about all I have to report tonight. So thank you very much.
Okay, thank you. Dan?
The environmental health staff has been focused on reviewing a lot of reopening plans. And then at this time, they're not currently doing restaurant inspections because of the COVID-19 pandemic. The health education folks have been working hard to communicating social media, communicating with the public, and carrying on with some of their regular duties, but electronically, which is a challenge. But they've been also been trained. A couple of them have been trained to be contact tracers. So when the need increases for that, they will be ready to go. Of course, Aaron has been swamped with COVID-19, and we also have a PRN epi specialist who's been helping with communicable disease reporting as well as COVID-19. And of course, Kat, our emergency response planner, has been busy working with folks like City of Riverside and other emergency response or emergency management folks in the region. That's all I have.
All right. Angela?
Okay, as Mary Jo mentioned, we've been mainly preparing to get things ready to go to reopen our clinics and just making sure that our waiting rooms are prepared and our exam rooms are prepared. We've continued to do COVID testing 5 days a week in the Parkville Clinic, and we'll continue to do that well. And just doing what we can, staying busy, continuing with what we normally do. Does anybody have any questions about my report?
Anyone, questions from the board? Not at this time.
Okay, thank you.
Thank you. All right, financial report?
I kind of gave an overview. Is there any questions about the report or?
Yeah, I have one.
Okay.
On page 33, the COVID leave, $7,100. Now, didn't we let a couple of people off or something?
There, Cindy, if you can pitch in on that, I'll try to fill in here until you get in. But we had some folks who early on with COVID had some illnesses that that was before we had proper testing capabilities. So the COVID leave was used there. So
That's correct.
Where'd the COVID leave? Is that our money, health department money?
Yes.
Okay.
Yeah, the board had voted at a previous meeting to allow, as per the federal government, to allow a 2-week period of time if needed throughout COVID.
Okay, any other questions?
We can move to the bills.
Okay, we're ready to pay the bills. Review, approve them. Any questions about any of the bills?
I make a motion that we pay the bills. This is Dr. Hills.
Oh, I'll second.
Second, any other discussion about the bills? Kathy Wright, you approve?
Yes.
Kathy Hill?
Yes.
Paula?
She can't.
Dr. Hills?
Yes, I made the motion.
Paula said yes by checks, so. Right, so the bills are approved.
Okay.
Now we need the fee resolution amendment.
Just need to sign the updated fee schedule. That needs to be signed by Dr. Jackson and our secretary. No changes.
No changes.
No. And then we have our voucher and warrants for signatures as usual. So Dr. Jackson.
Need a motion to approve the fee. We need a motion to approve the fee amendment.
Yes.
Someone.
Kathy Wright,
Second.
second Kathy Hill. All in favor?
Aye.
Kathy Hill?
Yes.
Paula?
You said yes?
Yes. And then Dr. Hills?
Yes.
Okay, all approved? It's approved.
I
All right. And now we're ready to approve the review and approve the minutes of the meeting from April 21st, 2020, regular board meeting.
Can we do those all together?
Yeah, I think you can.
Okay. We have several meetings to approve here, then April 21st, April 24th, April 28th, May 1st and May 12th,
And May 16th.
and May 16th. We have a motion to approve the minutes.
I move to approve. All those in favor?
Give a second.
Second.
All in favor, Kathy Wright,
Aye.
Kathy Hill,
Yes.
Paula? Dr. Hills?
I approve.
Yeah, I approve, all approved. Minutes are approved.
Happy?
All right.
I'm signing for you to do there.
So that's the end of the regular meeting.
Dr. Jackson, do you want to announce the next board meeting?
Okay, the next board meeting, scheduled board meeting is June 16th. Here at this building on Marshall Road at 7 p.m. Right. Any other business? Executive session.
I move we go into executive session.
I second.
Motion to go into executive session pursuant to 610.021, 13, and 13. Need a roll call vote. Kathy Wright,
Yes.
Kathy Hill,
Yes.
Paula,
When's the next meeting?
16.
Dr. Hills.
Yes.
Okay, we're moving into executive session at
June 16th.
9:01 p.m.
Appreciate all the comments and all
Yeah,
the.
thank you very much for all the public comments. We will be responding to you. And that's the end of the regular meeting. We're now in executive session.
Can we just call Paula and